Hi, welcome back to Rohrichknose Podcast, helping you become a better you. Thank you so much for subscribing to my podcast and my YouTube channel. I get so much great feedback, and I really appreciate it. Keep them coming. Give me ideas on what's new, what topics you'd like to hear. Today, let's talk about brachioplasty, or the arm lift. The arm lift is a very popular procedure, not only in the era of obviously the patient with massive weight loss, but also the aging patient. And these are things that actually require a lot of technical refinements. And I've written about this in one of our major journals, the Plastic Surgery Journal. And really what a brachioplasty is, it's an arm lift. It's one that can help improve the contour of your arm from your elbow all the way to your armpit. And it's a very powerful tool. There's several different ways of doing it. There's a traditional one with the long scar, then there's a shorter scar, then there's an inner scar, and then there's a liposuction only. So let's walk through some of these ways of doing upper arm contouring. I get a lot of questions about that. So who's a good candidate? You know, do you have a lot of skin laxity, fat, or skin tone? So the best way to determine that is with a pinch test. So if you have good skin tone and you have a moderate amount of fat like this patient, that's actually a good candidate for liposuction. But if you have poor skin tone and you can grasp your skin, and then that's not a good candidate for just liposuction only. So there's really three types: those with no skin laxity, those with a moderate amount of laxity in the inner arm, and then those with a lot of laxity, which require the big arm lift. So let's go over the simple to complex. So you can liposuction the arm with liposuction, both with ultrasound or plain liposuction, and that is done with a small little neck incision in the armpit, and then this is a result that you can see. It's very powerful in shaping and contouring a patient that has good skin tone, and it looks very nice, and it's got a small little neck incision. Then you can circumferentially suction them in these areas. Very powerful tool, very good results with this. And again, this is a patient that actually has a moderate amount of skin laxity, but did not want any scars, so we did that. And here's another one. And obviously, these are ones that give you a reasonably good result, but very little neck incision only. So these are very important. Now, what about if you have some skin laxity? And I have a lot of patients that are over 50 that really just have some skin laxity and some early creping skin of the upper inner arm. Now, that procedure is called a limited incision arm lift, and that's an incision that's made right in the armpit, and that's in a very selective patient that has inner arm skin laxity only. And it'll tighten the arm in that area, but it won't do anything with the outer arm in this area. But you can liposuction that. So the power of that is that it's hidden in the inner arm, and you can get some contouring in that. So you can take out a moderate amount of tissues, you can see here, and then you can shape it. And so here's a before and an after. And it gives you a reasonably good skin tone with obviously hiding the scar in the axilla. So the markings are quite simple. They're in the armpit themselves. And then you can shape it, and you can do liposuction of the arm. And then you can contour it. You can measure the amount that you're going to remove, which can be 5 to 7 centimeters. And then you can really take out that tissue, doing it very carefully, closing it, and here's some examples of that. On the left is a pre-op, and the right is a post-op. You can see it's a dramatic improvement in this area. Another patient arm lift, and here's another set of patients with the same type of thing. So I think it's a very powerful technique in the right patient. But that's the key, in the right patient, because if you don't select the right patient, you're going to still have some redundancy. Another patient, inner arm lift. You know, this is pushing the envelope a little bit. You're doing an inner arm lift, but you know, she obviously didn't want any more incisions, but it gives her a reasonable result. I mean, the better result would be with a posterior arm lift, but she didn't want that. So what if you have a moderate amount of skin laxity, but and you just want to have a small incision in that area? So you can do that. You can do it in a patient like this that really has some moderate amount of redundancy of skin, and you can certainly do an inner arm lift with that excision, with that dart in that area, and that actually looks good as well, and it really hides most of the scar in that area. So what about if you have a patient, this is very commonly seen, if you've had a lot of weight loss, or you just have congenitally had large arms, or the bat wings as we call them. And so these are the types of patients that really, really require some surgical procedures. And you can see that here's the marking. It goes all the way from the armpit all the way down into the axillary area. And you're marking this area very carefully. You're shaping it and contouring it. And then you really want to make sure in the operating room that you're confirming that, because you're going to do a pinch test to see how much you can take out. And this, obviously, you're taking out 6 to 7 centimeters, and then you're using a wetting solution, and then you're going to be liposuctioning in that area, and then contouring, and then you're going to be removing it. And then you can excise that entire area. And then you'll see that, you'll take it out, and this is a gentle removal of this area. You can see that you're going to be removing that, and then you're going to get meticulous hemostasis, and then you're going to close it, and you can see the shape and contour is quite dramatic. So that's a very powerful technique in patients that have significant lipodystrophy, such as this patient. She has significant lipodystrophy after significant weight loss, and we contoured her with this posterior arm lift. And here's another patient that has that. And these scars themselves are long, but they will take about 12 months to fade, and most of the time that's not an issue. And we use silicone sheeting in that area, stay out of the sun, and do all those things to help maximize the scar. And another posterior arm lift, very powerful procedure to do in these patients. And then there's another type of technique called the medial arm lift. I don't like this technique because it shows the scar in the inner arm, but it certainly can be done, and it works pretty reasonably well. And here's a patient that had that and had a revision after having that procedure, because the scars tend to widen in this area. So I think arm lifts are a very powerful procedure if done properly in the right indications, going from liposuction to inner arm lift to the extended arm lift. You can go home the same day, you can resume most of your activities, you can elevate your arms at 90 degrees, and you can be back doing everything by about 4 weeks. So the key is, know before you go, find a true body contouring expert, somebody that's got expertise in body contouring. How do you find out? You talk to them, you see their website, you look at their social media, you see if they have any photos of arm lift patients, and then you go talk to them. And obviously these are done by board certified plastic surgeons in the operating room. Most of the time it can be a day surgery patient. So the key is great outcomes, safety, know before you go, make sure you select the right plastic surgeon that can give you the optimal results that you want in this procedure. And these are very high satisfaction rates that I see in these types of patients. And I combine them often with other procedures like facelifts or rhinoplasties. So give me your comments, give me your thoughts, give me your questions. And remember, till next time, helping you become a better you.